Our next speaker is Dr. Divya Sanghi, Professor and Head in Department of Nutrition and Dietetics at Manav Rachna International Institute of Research and Studies. Dr. Sanghi completed her PhD from KGMC Lucknow. She will be speaking today on dietary inflammation index and cardiac health. Please welcome Dr. Divya Sanghi.
So, good morning, everyone, and thank you so much for providing this opportunity to discuss the things in the conference. So, the topic is the dietary inflammatory index and the cardiac health. So, we all know about the inflammatory markers that we have already talking about from the past 2 days, and we have already had a long discussion over it. So I'm not going to talk about the inflammation that we are already understood, but how the diet can be and play a role for decreasing that inflammation, and how we can categorize the diet under the anti-inflammatory and the pro-inflammatory diet that I am going to discuss today. So if we will categorize the diet, it is categorized between the two categories, anti-inflammatory diet and the pro-inflammatory diet, that we already know. And we already know that the anti-inflammatory diets are basically the vegetable, fruits and the whole grains, and the red meats are coming under the pro-inflammatory diets. So diet can either promote or reduce our systemic inflammation. I'm just talking about the systemic inflammation. And then the certain dietary patterns like the refined carbs, saturated fats, processed foods like our ultra processed foods, or if you are talking about the high fat, sugar, salt intake, that is also the contributing factor for the inflammation in our body. To quantify the inflammatory potential of a diet, many people are working in these areas, so we can say that this diet is basically coming under the anti-inflammatory diet, and if we are consuming these type of a diet, it can reduce the inflammation in your body. So this is the architecture of a dietary inflammation index. The DII is a literature derived population based scoring algorithm, so we can calculate it what is the dietary inflammation index of this particular diet, and we can put it under the category of the anti-inflammatory and the pro-inflammatory. That is basically depending on the 6 inflammatory biomarkers, that is IL-1, B4, 6, 10, TNF-alpha and the C-reactive proteins, and accordingly, if you are getting the negative scores, we can say that this is a anti-inflammatory diet, and if you're getting the positive scores, we can say that it's a pro-inflammatory diet. So these are the basic components of the DII, which talk about the macronutrients, carbohydrates, fats and proteins, and in micronutrients is talk about vitamin A, B complex, C, D and E, minerals, magnesium, zinc, selenium, iron and many more. So here you can see the table which shows the food parameters, that is 45 nutrients are listed under that, and in the third column you can see that the overall inflammatory effect score. So the every nutrient is having the inflammatory score. So suppose if we want to look for that which particular diet is coming under the pro-inflammation, so what we can do, we can calculate firstly whatever we are eating in a one day. So suppose I have taken the 5 meals, we can convert those meal pattern under the category of the nutrients, how much nutrients we have taken, and then accordingly by using this table and by looking at the overall inflammatory score of the nutrient, we can calculate the inflammatory score for that particular diet which we have consumed in a one day. So accordingly, if the score is coming in the positive scores, then it is a pro-inflammatory, and if it is coming into the negative category, we can say that this is the anti-inflammatory diet that we are consuming. So this calculation can be done on the basis of the Z score, percentile, certain central percentile will be required. So this is just a calculation algorithm we can use, that is very much published by the Shivappa et al. In the 2017 and very beautifully described in his table. mostly the data we are having that is coming from the Western population, and we have done it for the Indian population. So that is the need of an hour. We can also calculate and look for our dietary pattern. How many what is the score of our basically our diet, because our diet is completely different from the Western population. So high DII scores are associated with the elevated C-reactive proteins, pro-inflammatory cytokines, and the IL-10. The mechanism behind these is the pro-inflammatory diet activates the inflammatory markers, promote the cytokine productions, and leads to the chronic low-grade inflammation. So that needs to be taken care. If we will look for the DII and the cardiovascular diseases, so there are several studies which has been published in this area and shown their results, like that if you are taking a pro-inflammatory diets, it will increase the CVD incidence, and it will also lead to the cardiovascular mortality and increased risk of the atherosclerosis and the vascular inflammation. So the individuals with the high pro-inflammatory diets are having 32% higher risk of the cardiovascular diseases and 24% higher risk of the CVD mortality as well. So the CVD high DII scores are linked with the several CVD risk factors like abdominal obesity, dyslipidemia, hypertension, insulin resistance, and the metabolic syndrome. So here I am just presenting the result of some studies which has been conducted on the cardiovascular diseases and the DII. This is a very famous study which has been conducted on the dietary index and the CVD incidence in the Sun cohort. And you can clearly, here it is visible on the graph that if the person is falling under the high DII quartiles and taking a high dietary index, high dietary inflammatory index, they are having the high incidence of the cardiovascular disease. Next study, which is also here you can see that a forest plot which is presenting the estimate of including studies estimating the association between the DII and the CVD mortality. So in the end you can see the overall, if we will see that there is higher relative risk of a 1.31 fold in the person who are taking the higher DII score diets, that's a pro-inflammatory diet. This study is also presenting the relationship between the high DII or the pro-inflammatory diet and between the LDL-C. So if you are taking a pro-inflammatory diet, so persons are having the high LDL-C, which is also proving that if you are taking a pro-inflammatory diet from the long time, then definitely after some time your inflammatory markers will be increased. As nutritionists, because diet is something which is very easily modifiable if you are taking care of it. So if you are working on the diet, if we can change our dietary pattern, and it is not like that, suppose if today I have taken a diet which is having a pro-inflammatory, and next day I have taken a diet which is anti-inflammatory. So it is not going to play any role. You have to be continuous, because the diet outcome, if we will say, it comes after the certain time, after 3 months or 6 months or 8 months. So if you are looking any change by changing the diet pattern, then definitely you have to have very much focused and the consistent. Then only you will get the positive result. Otherwise, it will be difficult to get the results. So diet adherence is in a very, very big role, I can say, and it's a very focused part, because whenever the patient comes to our OPD, generally they change their diet whenever they receive the counseling. But after some time, 10 days or 15 days, again they go back to their normal diet. And then after the 15 days, again they come to us and they say that, yes, we haven't received any change by following your diet, because you haven't followed that diet. You are just changed your diet for a certain period of a time, and then you again go back to your normal diet. So that's not going to play any positive role if you are looking for. Similarly with the dietary inflammatory index as well. So these are the multiple papers I have listed here, which is also proving that if you are taking a pro-inflammatory diet, then definitely your risk of the CVD and the inflammatory markers will be increased. So that needs to be taken care. And these are the dialects of the dietary inflammation, which I am talking about. That is the dietary inflammatory index. That is the original one, which will focus only on the derived parameter, and the global applicability and the acceptability is there because lots of studies are already done. The second one is the EDII, which is the energy adjusted. So if we will look for the Indian population, because there is lot of heterogeneity in the energy consumption in the Indian population, so we should go with the energy adjusted DII, not the simple DII, because some people are consuming only 1000 kilocalories and some are consuming the 2000. So there is lot of heterogeneity in the data if we will look for the only energy consumption part. The other one is the empirical dietary inflammatory pattern, which talks about the food group. So the list which I have shown you, that is talking about the nutrients. That is not talking about the food groups. But whenever we do the counseling, we generally talk about the food groups, not the nutrients, because the patient has not been able to understand. If I will say take 30 gram of a vitamin C or the 60 gram of a protein, but from where these nutrients are coming, that is also very important. So the EDIIP, that is the empirical dietary inflammation pattern, is coming into the picture, and it is very easy if we will talk in the terms of a patient to make it explain it, because it is easy to understand because we are talking in the terms of the food groups. Next one is the lifestyle inflammatory score. So there are a lot of contributing factor of the inflammation if whenever we talk about. So we talk always about the physical activity, smoking, BMI and the other factors as well, because diet is not only factor which is talking about the inflammation parameter. So if we will using the LIS along with the DII, so if what we are doing, basically we are controlling the diet by controlling the lifestyle inflammation scores as well. That will give you the more positive result, because the lifestyle inflammatory scores or the inflammatory parameters are also contributing towards the inflammatory markers. So that is needs to be studied, because most of the studies has done on the DII, not on the EDII even. So in Indian population, if we will say, we can talk about the EDII and the combination of the LIS along with the DII. So from indexing to the intervention, the dietary inflammatory index provides the quantitative framework necessary to treat the diet not just as a fuel, but as a modifiable medical intervention for the systemic inflammation. So that scoring is already been developed. We have to create it for the Indian population, and then we can plan those interventions for our patient, how our diet can be helpful for reducing the inflammatory markers. So these are the basically a conclusion, or we can say that takeaway from my lecture, that is a diet inflammatory index is a validated tool to assess the inflammatory potential of a diet. Higher DII score indicate the pro-inflammatory dietary patterns. Pro-inflammatory diet significantly increase the cardiovascular and metabolic disease risk. Improving the dietary pattern can reduce the inflammation and improve the population health. So lot of studies need to be done, because whenever we talk about the dietary patterns or the calculation, it is very subjective, because now we are having certain softwares, but taking the information what you have consumed in the last 1 day, 2 day or a 3 day, it's very, very difficult, and that's why we are not being able to develop the correct tools, and whatever the tools we are having, that is very, very subjective. So that needs to be taken care. It can be related with the biochemical markers, inflammatory markers, and then we can say that yes, this tool is also validated for the Indian population. Thank you so much.
Thank you, doctor. You spoke very well on inflammation in diet and how to measure it using the dietary inflammation score, and how to use it in our practice. Thank you. Any questions? questions. Thank you.
Thank you
Doctor.
so much.